Most people have eye problems at one time or another. Some are minor and will go away on their own, or are easy to treat at home. Others need a specialist's care. Whether your vision isn't what it used to be, or never was that great, there are things you can do to get your eye health back on track. See if any of these common problems sound familiar, and always check with the doctor if your symptoms are really bad or don't clear up within a few days. Eye strain. Anyone who reads for hours, works at a computer, or drives long distances knows about this one. It happens when you overuse your eyes. They get tired and need to rest, just like any part of your body. If your eyes feel strained, give them some time off. If they are still weary after a few days, check with your doctor to make sure it isn't another problem. Red eyes. Their surface is covered in blood vessels that expand when they are irritated or infected. That gives your eyes the red look. Eye strain can do it, and so can a late night, a lack of sleep, or allergies. If an injury is the cause, get it checked by your doctor. Red eyes could be a symptom of another eye condition like conjunctivitis, pink eye, or some damage from not wearing shades over the years. If over-the-counter eye drops and rest don't clear it up, see your doctor. Night blindness. Is it hard to see at night, especially while driving? Is it tough to find your way around in dark places such as movie theaters? That sounds like night blindness. It's a symptom, not a problem in its own right. Nearsightedness, cataracts, keratoconus, and lack of vitamin A all cause a type of night blindness that doctors can fix. Some people are born with this problem, or it might develop from a degenerative disease involving the retina, and that usually can't be treated. If you have it, you will need to be extra careful in areas of low light. Lazy eye. Lazy eye or amblyopia happens when one eye doesn't develop properly. Vision is weaker in that eye, and it tends to move lazily around while the other eye stays put. It's found in infants, children, and adults, and rarely affects both eyes. Treatment needs to be taught immediately for infants and children. Lifelong vision problems can be avoided if a lazy eye is detected and treated during early childhood. Treatment includes corrective glasses or contact lenses and using a patch or other strategies to make a child use that lazy eye. Cross eyes, strabismus, and nystagmus. If your eyes aren't lined up with each other when you look at something, you could have strabismus. You might also hear it called cross eyes or wall eye. This problem won't go away on its own. Sometimes you can go to vision therapy with an eye doctor to help strengthen the weak eye muscles. Often, you will likely need to get an ophthalmologist or eye surgeon specialist to correct it surgically. You will need to get an ophthalmologist or eye specialist to correct it. With nystagmus, the eye moves or jiggles all the time on its own. There are many treatments, including vision therapy, to make sure your eye is stronger. Surgery is also an option. Your doctor will examine your eyes to see which treatment might work best for you. Color blindness. When you can't see certain colors or can't tell the difference between them, usually reds and greens, you may be color blind. It happens when the color cells in your eyes, the doctor will call them cone cells, are absent or don't work. When it's most severe, you can only see in shades of gray, but this is rare. Most people who have it are born with it, but you can get it later in life from certain drugs and diseases. Your doctor can tell you what's to blame. Men are much more likely to be born with it than women. Your eye doctor can diagnose it with a simple test. There is no treatment if you are born with it, but a special contacts and glasses can help some people tell the difference between certain colors. Uveitis. This is the name of a group of diseases that cause inflammation of the uvea. That is a middle layer of the eye that contains most of the blood vessels. These diseases can destroy eye tissue and even cause eye loss. People of all ages can have it. Symptoms may go away quickly or last for a long time. People with immune system conditions like AIDS, rheumatoid arthritis, or ulcerative colitis may be more likely to have uveitis. Symptoms may include blurred vision, eye pain, eye redness, light sensitivity. See your doctor if you have these symptoms and they don't go away within a few days. There are different kinds of treatment of uveitis depending on the type you have. Your eyelids do a lot for you. They protect your eye, spread tears over its surface, and limit the amount of light that can get in. Pain, itching, tearing, and sensitivity to light are common symptoms of eyelid problems. You might also have blinking spasms or inflamed outer edges near your eyelashes. Treatment could include proper cleaning, medication, or surgery. Vision changes. As you get older, you may find that you can't see as well as you once did. That's normal. You will probably need glasses or contacts. You may choose to have surgery, LASIK, to correct your vision. If you already have glasses, you may need a strong prescription. Other more serious conditions also happens as you age. Eye diseases like macular degeneration, glaucoma, and the cataracts can cause vision problems. Symptoms vary a lot among these disorders, so keep up with your eye exams. Some vision changes can be dangerous. Some vision changes can be dangerous and need immediate medical care. Anytime you have a sudden loss of vision, or everything looks blurry, even if it's temporary, see a doctor right away. Problems with contact lenses. They work well for many people, but you need to take care of them. Wash your hands before you touch them. Follow the care guidelines that came with your prescription, and follow these rules. Never with them by putting them in your mouth. That can make an infection more likely. Make sure your lenses fit properly, so they don't scratch your eyes. Use eye drops that say they are safe for contact lenses. Never use homemade saline solutions. Even though some lenses are FDA approved for sleeping in them, doing so raises the risk of serious infection. If you do everything right and still have problems with your contacts, see your eye doctor. You might have allergies, dry eyes, or just be better off with glasses. Once you know what the problem is, you can decide what's best for you. This happens when you lose the ability, despite good distance vision, to clearly see close objects and small print. After age 40 or so, you may have to hold a book or other reading material further away from your eyes to make it easier to read, sort of like your arms are too short. Reading glasses, contact lenses, LASIK, which is laser eye surgery, and other procedures that can be used to restore good reading vision. Floaters. These are tiny spots or specks that float across your field of vision. Most people notice them in well-lit rooms or outdoors on a bright day. Floaters are usually normal, but sometimes can be a sign of more serious eye problem like retinal detachment. That's when the retina at the back of your eye separates from the layer underneath. When this happens, you might also see light flash along with the floaters, or a dark shadow come across the edge of your sight. If you notice a sudden change in the type or number of spots or flashes you see, or a new dark curtain in your peripheral vision, go to your eye doctor as soon as possible. Dry eyes. This happens when your eyes can't make enough good quality tears. You might feel like something is in your eye or like it's burning. Rarely, in severe cases, extreme dryness can lead to some loss of vision. Some treatments include using a humidifier in your home, special eye drops that work like real tears, plugs in your tear ducts to lessen drainage. LipiFlu, a procedure that uses heat and pressure to treat dry eyes. Testosterone eyelid cream. Nutritional supplements with fish oil and omega-3. Excess tearing. It has nothing to do with your feelings. You might be sensitive to light, wind, or temperature changes. Try to protect your eyes by shielding them or wearing sunglasses. Tearing may also signal a more serious problem like an eye infection or a blocked tear duct. Your eye doctor can treat or correct both of these conditions. Cataracts. These are cloudy areas that develop in the eye lens. A healthy lens is clear like a camera. Light passes through it to your retina, the back of your eye, where images are processed. When you have a cataract, light can't get through as easily. The result, you can see as well, and may notice glare or halo round lights at night. Cataracts often form slowly. They don't cause symptoms like pain, redness, or tearing in the eye. Some stay small and don't affect your sight. If they do progress and affect your vision, surgery almost always works to bring it back. Glaucoma. Your eye is like a tire. Some pressure inside it is normal and safe, but levels that are too high can damage your optic nerve. Glaucoma is a name for a group of diseases that cause this condition. A common form is primary open-angle glaucoma. Most people who have it don't have early symptoms or pain, so it's important to keep up with your regular eye exams. It doesn't happen often, but glaucoma can be caused by an injury to the eye, blocked blood vessels, inflammatory disorders of the eye. Treatment include prescription eye drops or surgery. Retinal disorders. The retina is a cell lining on the back of your eye that is made up of cells that collect images and pass them on to your brain. Retinal disorder can damage the retinal cells and block this transfer. There are different types. Age-related macular degeneration, which refers to a breakdown of small portion of retina called the macula. Diabetic retinopathy is damage to the blood vessels in your retina caused by diabetes. Retinal detachment happens when the retina separates from the layer underneath. It's important to get an early diagnosis and have these conditions treated. Conjunctivitis, pink eye. In this condition, tissue that lines the back of your eyelids and the cover your sclera gets inflamed. It can cause redness, itching, burning, tearing, discharge, or a feeling that something is in your eye. People of all ages can get it. Causes include infection, exposure to chemicals and irritants, or allergies. Wash your hands often to lower your chances of getting it. Corneal diseases. The cornea is a clear dome-shaped window at the front of your eye. It helps to focus the light that comes in. Disease, infection, injury, and exposure to toxins can damage it. Signs include red eyes, watery eyes, pain, reduced vision, or a halo effect. The main treatment methods include a new eyeglasses or contacts prescription, medicated eye drops, surgery. What is diplopia? Diplopia is when you see two images of the same thing. You might know it's as double vision. You might have diplopia in one eye or both. Generally, double vision in both eyes is more serious if you have it in just one. Diplopia types and causes. To understand how diplopia can happen, it helps to know the parts of your eye and how they work together. Double vision in only one eye is called monoocular diplopia. It might involve your cornea. This is a clear window into your eye. Its main job is to focus light. If your double vision goes away when you cover one eye, but remains when you switch and cover the other eye, you might have cornea damage in the eye that's seeing double. It could be that your cornea is uneven. Glasses can probably fix the problem. Damage can be from keratoconus, infections, scars, dryness. Lens. The side behind your pupil, the opening in your eye, and helps focus light onto the retina in the back of your eye. Cataracts are the most common lens problems. Surgery almost always fixes them. You can have cataracts in only one eye. Double vision when both eyes are open is called binocular diplopia. It might involve your muscles. They control eye movement and they keep your eyes aligned with each other. If a muscle in one eye is weak, it won't move in sync with the other eye. When you look in direction controlled by the weak muscle, you see double. Eye muscle problems can be from a problem with the nerves that control them. Myasthenia gravis, an autoimmune illness that stops nerves from telling your muscles what to do. Early signs include double vision and dropping eyelids. Graves' disease, a thyroid condition that affects eye muscles. It can cause vertical diplopia where one image is on the top of the other. Nerves, they carry information from your brain to your eyes. Problems with them can lead to double vision. Multiple sclerosis, Guillain-Barré syndrome, diabetes. Multiple sclerosis can affect nerves anywhere in your brain or spinal cord. If it damages the nerves that control your eyes, you may see double. Guillain-Barré syndrome is a nerve condition that causes growing weakness. Sometimes the first symptoms are in your eyes, including double vision. Diabetes can cause nerve damage in the muscles that move your eyes, that can lead to double vision. Brain. The nerves that control your eye connect directly to your brain, where damages are handled. Many causes of double vision start in the brain. They include strokes, aneurysms, increased pressure from injury, bleeding or infection, tumors, migraine headaches. Here we will talk about diplopia symptoms. If you have double vision, you may also notice one or both eyes not lining up, a wandering eye or cross-eyed look, pain when you move your eye, pain around your eyes like in your temples or eyebrows, headache, nausea, weakness in your eyes or anywhere else, droopy eyelids. Diplopia diagnosis. Double vision that's new or doesn't have a clear cause can be serious. Your doctor will probably use more than one test to find out what's causing your diplopia. They might try blood test, physical exam, or an imaging test like a CT exam and an MRI. Tell your doctor about all your symptoms before your appointment. Think about these questions. When did the double vision start? Have you hit your head, fallen, or passed out? Were you in a car accident? Is this double vision worse at the end of the day or when you are tired? Have you had any other symptoms besides double vision? Do you tend to tilt your head to one side? You might not know that you do it. Look at all the pictures or ask family members. Does a double vision happen only with both eyes open? Try focusing on something that isn't moving, like a window or a tree. Ask yourself these questions. Are the two images side by side, or is one on the top of the other? Are they slightly slanted? Which one is higher or lower? Are both images clear but not in line? Or is one blurry and the other is clear? Cover one eye and then switch. Does the problem go away when either eye is covered? Imagine that your field of vision is a clock face. Move your eyes around the clock from noon to 6 and around to 11 again and to 12 again. Is your vision better or worse at any position? Tilt your head to the right and then to the left. Do any of these positions improve your eyesight or make it worse? Diplopia treatment. The most important thing is to identify and treat the cause. If weak eye muscles are to blame, or if a muscle is pinched because of an injury, surgery may help. Medications can treat myasthenia gravis. Surgery or medicine can treat Graves' disease. Medicines and insulin can control blood sugar in diabetes. Diplopia prevention. There is no way to prevent diplopia from cataracts or some other causes, but to avoid injuries that can give you double vision, wear your seat belt when you are in a car, and use protective goggles or headgear when you play sports or do activities that might hurt your eyes. If you have diabetes, keep your blood sugar under control to lower your chance of nerve damage. Diplopia outlook. Almost 70% of cases get better with medication and surgery, such as cataract surgery. Sometimes, diplopia clears up on its own. Your result will depend on the cause of your double vision. If your double vision is permanent, treatments can help you live with it. Special eyewear, like an eye patch or prism glasses, can ease the effects. Fuchs dystrophy. This inherited condition causes slow breakdown of endothelial cells and swelling of the cornea. This makes it harder to remove water from your stroma. Your eye swells and your vision gets worse. Haze and small blisters may appear on the surface. Signs of the disease may appear in your 30s or 40s, but it takes about 20 years for it to affect your vision. Women get it more often than men. An early sign, you wake up with blurred vision that slowly clears during the day. As the disease worsens, swelling becomes more consistent and vision stays blurry. Treatment includes eye drops, ointments, drying your swollen cornea with a hair dryer at arm's length 2 or 3 times a day. Corneal transplant, full or partial. Lattice dystrophy. This is abnormal protein fibers in stroma. It can happen at any age, but early changes can be seen in childhood. It gets its name from clear overlapping lines of proteins. They can make your cornea cloudy and reduce your vision. They can wear down your epithelial layer. Treatments include prescription eye drops, ointments, eye patches, corneal transplant. Symptoms may go away with treatment, but over time, you may need a corneal transplant. Results of this surgery are usually good, but the condition can come back. How are cornea problems diagnosed? You will need a thorough exam by an eye doctor. Can you prevent them? Follow strict hygiene guidelines if you wear contact lenses. Improper use in the mid-region for developing corneal diseases. That will lower your chances of corneal infection related to the use. Don't sleep with contact lens in, even if they are FDA approved for it. This habit greatly raises your risk of cornea infections. You can't prevent diseases that you get from your parents, like dystrophies, but you can hang on to your vision if you find and treat them early. Talk about keratoconus. Normally, your cornea, the clear outer lens or windshield of the eye, has a dome shaped like a ball. Sometimes the structure isn't strong enough to hold its round shape, and it bulges outward like a cone. This is called keratoconus. Tiny fibers of protein in your eye, called the collagen, help hold your cornea in place. When these fibers get weak, they can't hold their shape. Your cornea gets more and more cone-like. It happens when you don't have enough protective antioxidants in your cornea. Its cells produce harmful byproducts the same way a car puts out exhaust. Normally, antioxidants get rid of them and to protect the collagen fibers, but if levels are low, the collagen weakens and the cornea bulges. What causes it? We don't know exactly what causes keratoconus. Researchers think that some people are more likely to get it from birth. Several things may have a link to the condition. Family history. If someone in your family has this condition, you have a greater chance of getting it yourself. If you have it, get your children's eyes checked for signs starting around age 10. Age. It usually starts when you are a teenager, but it might show up earlier in childhood or not until you are 30. It can also affect people 40 and older, but that's less common. Certain disorders, studies have found a connection between keratoconus and systemic conditions such as Down syndrome, Ehlers-Danlos syndrome, osteogenesis imperfecta, and retinitis pigmentosa. Inflammation. Inflammation from things like allergies, asthma, or atopic eye disease can break down the tissue of the cornea. Eye rubbing. Rubbing your eyes hard over time can break down the cornea. It can also make a keratoconus progress faster if you already have it. Race. One study of more than 16,000 people with keratoconus found that people who are black or Latino are roughly 50% more likely to get it than people who are white. Can it damage vision? Changes to the cornea can make it impossible for your eye to focus without glasses or contact lenses. In fact, you may need a corneal transplant to restore your sight if the condition gets bad enough. Laser vision correction surgery (LASIK) is dangerous if you have keratoconus. It can weaken your cornea more and make your vision worse. Even if you have only a small degree of keratoconus, don't get LASIK surgery. What are the symptoms? Keratoconus changes your vision in two ways. As the cornea changes shape from a ball to a cone, the smooth surface becomes wavy. This is called irregular astigmatism. As the front expands, your vision becomes more sighted. That means you can see objects clearly only when they're up close. Anything too far away looks like a blur. An eye doctor may spot the signs during an eye exam. He should also mention symptoms like double vision when looking with just one eye, objects both near and far that look blurry, bright lights that appear to have halos around them, light streaks, triple ghost images, blurry vision that makes it hard to drive. How is it diagnosed? Your doctor needs to measure the shape of your cornea. There are different ways, but the most common is called corneal topography. The doctor snaps a photo of your cornea and it checks it closely. Children of parents with keratoconus should have one every year starting at age 10. How is it treated? You will probably start with new glasses. If you have mild case, new eyeglasses should clear things up. If they don't, your doctor will suggest contact lenses. Rigid gas permeable contacts are usually the first choice. Over time, you may need other treatments to strengthen your cornea and improve your sight. A treatment called cornea collagen cross-linking may stop the condition from getting worse, or your doctor could implant ring called an Intex under the cornea's surface to flatten the cone shape and improve vision. When other treatments don't give you good vision, the last resort is a cornea transplant. This is a very safe operation and it's successful in more than 90% of cases. The doctor will remove the center of your cornea, replace it with one from a donor, and stitch the new one into place. You may need contact lenses afterward. Now, we will talk about cornea problems. The cornea is your eye's clear, protective outer layer. Along with the sclera, the white of your eye, it serves as a barrier against the dirt, germs, and the other things that can cause damage. Fun fact, your cornea can also filter out some of the sun's ultraviolet light, but not much. So your best bet to keep it healthy is to wear a pair of wrap-around sunglasses when you are outdoors. It also plays a key role in vision. As light enters your eye, it gets refracted or bent by the cornea's curved edge. This helps determine how well your eye can focus on objects close up and far away. If your cornea is damaged by disease, infection, or an injury, the resulting scars can affect your vision. They might block or distort light as it enters your eye. Cornea structure. To understand the potential problems, it helps us to know the parts of the cornea. It has three main layers. Epithelium, the outermost layer, it stops outside matter from getting into your eye. It also absorbs oxygen and nutrients from tears. Stroma, the middle and the thickest layer, lies behind the epithelium. It's made up mostly of water and proteins that give it an elastic but solid form. Endothelium, this is a single layer of cells on the very back of the stroma. The aqueous humor, a clear fluid in the front chamber of your eye, is in constant contact with this layer. It works like a pump. The stroma absorbs excess liquid and the endothelium pulls it out. Without this function, the stroma would become waterlogged. Your cornea would get opaque and hazy, and so would your vision. Symptoms of cornea problems. The term corneal disease refers to many conditions that affect this part of your eye. This include infections, tissue breakdown, and the other disorders you get from your parents. Your cornea usually heals itself after most minor injuries or infections, but during the healing process, you might notice symptoms like pain, blurred vision, tearing, redness, extreme sensitivity to light. These symptoms also come with other eye problems, so they may signal a more serious issue that requires special treatment. If you have them, go to eye doctor. What conditions that can cause damage? Keratitis. This inflammation sometimes occurs after viruses, bacteria, or fungi get into the cornea. They can get in after an injury and cause infection, inflammation, and the ulcers. If your contact lenses cause an eye injury, that too can lead to keratitis. Symptoms to look out for: severe pain, blurred vision, tearing, redness, extreme sensitivity to light, discharge. Treatment usually includes antibiotic or antifungal eye drops. Some people need antiviral drugs and steroid eye drops. Ocular herpes, herpes of the eye, like fever blisters. This viral infection can come back again and again. The main cause is the herpes simplex virus 1. The same one that leads to cold sores. It can also result from the sexually transmitted herpes simplex virus 2 that causes genital herpes. This condition creates sores on the cornea. Over time, the inflammation can spread deeper into cornea and the eye. There is no cure, but you can often control it with antiviral drugs or steroid eye drops. Herpes zoster shingles. You can only get it if you had chickenpox. The itchy illness goes away, but the virus that causes it doesn't leave your body. It stays in your nerves, but it isn't active. Later in life, it can travel down those nerves and infect specific body parts like your eye. A shingles rash on the face can cause sores on your cornea. They usually heal by themselves, but antiviral medication and the topical steroid eye drops can ease inflammation. Anyone exposed to a chickenpox virus can get shingles, but the chances are higher for older adults, especially over 80. People with a weakened immune system. See your doctor if you have any symptoms. If you are over 50, get the vaccine. Corneal degenerations. There are several types. This disease can cause problems with cornea structures. Keratoconus. As we talked about before, this disease thins your cornea and it changes its shape. Your cornea steepens and it becomes a cone shape in a bottom portion. It usually starts blurring vision during teenage years and worsens during early adulthood. It changes to the cornea's curvature can create mild to severe distortion called astigmatism and usually nearsightedness. The disease can also cause swelling, scars on your cornea, and vision loss. Your night vision could get so bad you can't drive after dark. Corneal dystrophies. There are more than 20 of these diseases. They cause structural problems within your cornea. Some of the most common are map-dot fingerprint dystrophy. This affects the back layer of your epithelium, which separates it from stroma. It grows irregularly, thick in some places, thin in others. That causes irregularities in your cornea that look like maps, dots, and small fingerprints. It usually affects adults over 40. It's usually painless, doesn't affect your vision, and it gets better without treatment. But sometimes the epithelium layer can get worn down and expose the nerves that line your cornea. That causes severe pain, especially when you wake up in the morning. It can also change your cornea's normal curve and cause astigmatism, nearsightedness, or farsightedness. As your cornea changes, your vision may get blurry. You may also notice moderate to severe pain. increased sensitivity to light, excessive tearing, a feeling that something is in your eye. Treatments include an eye patch, a soft contact lens, bandage, eye drops, ointments, taking it down, or removing the loose layer. This is a minor procedure. Your doctor can do it in the office. What is a corneal ulcer? A corneal ulcer is an open sore on your cornea, the thin clear layer over your iris, the colored part of your eye. It's also known as keratitis. Corneal ulcer symptoms. A corneal ulcer can cause redness, severe pain, the feeling that something is in your eye, tears, pus or thick discharge from your eye, blurry vision, pain when looking at bright lights, swollen eyelids, a round white spot on your cornea. When to call your doctor? Talk to your doctor right away if you notice vision changes, severe pain, discharge from your eye. It's especially important to watch for problems if you have scratched your cornea before, or if you have been around the chemicals or small particles like sand, metal, or glass. Corneal ulcer causes. Infections cause most corneal ulcers. Bacterial infections, viral infections, fungal infections, parasitic infections. Viral infections such as herpes simplex virus, which causes cold sores, or the varicella virus, which causes chickenpox and shingles. Fungal infections, possibly after an injury by something natural like a branch or twig. These infections are rare. Parasitic infections with acanthamoeba and amoeba found in fresh water and dirt. Corneal ulcer risk factors. People who wear contact lenses are more likely to get corneal ulcers. This risk is 10 times higher if you use extended wear overnight soft contacts. Bacteria on the lens or in your cleaning solution could get trapped under the lens. Wearing lenses for long periods can also block oxygen to your cornea, raising the chances of infection. Scratches on the edge of your contact might scrape your cornea and leave it more open to bacterial infection. Tiny particles of dirt trapped under the contact could also scratch your cornea. Other things that may make you more likely to have corneal ulcer include steroid eye drops, disorders that cause dry eyes, eyelid inflammation, blepharitis, eyelash that grow inward, eyelids that turn inward, conditions that affect your eyelid and keep it from closing all the way, like Bell's palsy, chemical burns, or other corneal infection or injuries. Corneal ulcer diagnosis. See your eye doctor right away. They will use a drop of dye and a special microscope called a slit lamp to look for problems. If your doctor thinks you have an infection, they may take a small sample from the ulcer for analysis in lab. This can help them decide on the best treatment. Corneal ulcer treatment. Medications. Depending on the cause of your ulcer, you will probably get antibiotic, antiviral, or antifungal eye drops. You might need to use these as often as once an hour for several days. To treat pain, your doctor may also give you oral painkillers or drops to dilate your pupil. Surgery. If medications don't help, or if the ulcer is severe, you might need a corneal transplant. Your doctor takes out your cornea and replaces it with a healthy one from another person. Treatment follow-up. You will need to see your doctor every day until they tell you to stop. Call them right away if your symptoms get worse, such as blurry vision, pain, or discharge. And now, we will talk about dry eye. Even when you are happy, your eyes are full of tears. They provide moisture and lubrication to help you see and keep your pupils comfortable. What's in a tear? They are a mix of water, oils, mucus, antibodies. Water for moisture, oils for lubrications, mucus for even spreading, antibodies and special proteins that keep infection at bay. The ingredients come from special glands around your eye. Dry eyes often mean your tear system is out of whack. When tears don't provide enough moisture, you might notice a gritty feeling like there is something in your eye, itching, redness, blurry vision, light sensitivity. Sometimes the dry eyes create too many tears. This confusing condition is called reflex tearing. It happens because the lack of moisture irritates your eye. It sends a distress signal through your nervous system for more lubrication. Your body sends a flood of tears to try to make up for the dryness. It's a lot like what happens when you get sand in your eye and it runs. But these tears are mostly water, so they don't act like normal tears. They can wash dirt away, but they can't coat your eye's surface. What causes dry eyes? Sometimes there is lack of balance in your tear flow system, or your air conditioner, heater, or other things around you could dry out your tear film. Other causes include the natural aging process, especially menopause, side effects of certain drugs like antihistamines, diseases that affect your ability to make tears like Sjogren's syndrome, rheumatoid arthritis, and collagen vascular diseases, problems that don't allow your eyelids to close the way they should. How are dry eyes treated? There are a number of options. Ask your eye doctor what to do. Treatments include artificial tear drops and ointments. This is the most common treatment. Many types of drops are available over the counter. No one product works for everyone, so you might have to try a few to figure out the one that's right for you. If you have chronic dry eye, you need to use the drops even when your eyes feel fine, or they won't stay wet enough. If your eyes dry out while you are asleep, you can use a thick product like an ointment at night. You might think about sleeping with airtight goggles on. They will create a mini moisture chamber for your eyes. Temporary punctal occlusion. Your doctor might opt to close the punctum, or duct that drains tears from your eye. They might start with a temporary plug designed to dissolve over time. Based on how it works, your doctor will know whether permanent plugs will help. Non-dissolving punctal plugs and the punctal occlusion by a cautery, application of heat to treat tear exit duct. If temporary plugs work well, your doctor may move to longer lasting ones, or may go right to a long lasting plug. Or they could choose a procedure called cautery. You might get a drug that relaxes you, then use a special tool to burn the opening shut. The scar that forms makes a permanent plug. This measures increases your tear level by blocking the drain pipe, through which tears usually go from your eye to your nose. Tear plugs are easy to remove, but sometimes they come out on their own, or fall down the tear drain. They can make your eyes feel better and lower your need for artificial tears. LipiFlow. This medical device uses heat and pressure to unclog plugged glands on your eyelids. These glands produce the oil in your tears. It keeps your eye moist and prevents your tears from evaporating. Testosterone cream. Dry eye can be related to a lack of testosterone in the oil glands on your eyelids. The doctor might give you a testosterone cream that you apply to your eyelids. It can help your oil glands work better. Cyclosporin, Zedra, other medications and nutrition. You can use steroid eye drops for short periods along with long-term measures, adding fish oil or omega-3 to your diet